What is the best exercise for chronic low back pain and sciatica? Why does social media suck when it comes to getting evidence-based advice? Why do people fall for it? What does the research say? What should we be doing instead? This is what we're talking about on today's episode. I'm Dr. Anthony Davis. I'm joined by Dr. Blake Loxterkamp. If you don't know who he is, he helps out a lot behind the scenes, helping us dig up all the amazing research that we cite constantly on our channel, as well as behind the scenes in our Beyond Back Pain program. Not to mention World Buddies from school, and he helped me design our program. So we are going to talk about these things. Let's get into it. Blake, what is the best exercise for low back pain and sciatica? Just give me one exercise. I just want to solve my 10 years of chronic pain with one exercise. So if you had to pick one, what would it be?
Feel like it depends on the month. Social media kind of seems to pick a favorite one every different month. Like it's
Yep.
Jefferson curls, and then it's no, those are the worst. You got to do back extensions, and then for some reason you got to strengthen your ankles the next month.
Yeah. It's tib raises. It's
Yeah,
going to be
tip
tib
raises.
raises. That's it for the episode. We've decided that the best exercise for back pain is tibialis raises.
Yeah, because of the fascial lines that connect
Yeah,
your
because hashtag fascial lines,
yeah.
anatomy trains. So if you can't tell, obviously we're gonna maybe we'll try not to make fun of specific people, but we might.
Yeah.
If you know who they are and we make fun of their exercises, you'll know what we're talking about. Because here's the deal: there's so many ridiculous things, and we get these questions all the time. We even get these questions from people inside our program, and they're like, "Well, hey, what do you think about this?" Guy who only recommends back extensions and J curls. And we're like, well, I think there's nothing wrong with that particular exercise, except we have to ask, is that exercise too easy for you right now or too hard for you right now? Or is it
Yeah.
appropriate for you right now? Because there is, again, no magic exercise. And that's the difficulty with, I realize we're going to probably title this episode, like, what is the best exercise for back pain and sciatica? And that's the problem, is that all of these videos, promise that it's just this one. Just do this one. So,
Which
yeah, go ahead.
which is discouraging. I mean, it's really discouraging and I kind of went through this, way back in the beginning of chiropractic school of dealing with back pain. And you're like, you just keep trying these new exercises that everyone promises are going to be like the magic bullet. And you're kind of setting yourself up for failure because it doesn't fix it immediately. And you're like, what's wrong with me? Why doesn't this magic exercise work? So it's like this cycle of like see video, like your hope goes up, exercise doesn't fix it in 2 days, get disappointed, you know, and then it just kind of roller coasters, which is tough.
Well, and the promise too, they're using a lot of words like this one exercise will instantly,
Yep.
or immediately fix, right? Get immediate relief from your
Yeah.
sciatica and all that kind of stuff. And the trouble is, I think part of the reason why people fall for this stuff is that does it does actually provide immediate change,
Yep.
right? It's just temporary change is the problem. And so you get it's I don't know, it's like a drug addiction or something. Like here's a hit and then you get high off of the exercise and then immediately come down and then you need more and more and then you're assuming that there's a better high or a better exercise, a better fix for it. That one exercise did provide me temporary relief. So there must be some other exercise that's going to provide me permanent relief. And then
Yep.
people just swear by it. Like the amount of people that I get comments, it cracks me up. Like I'll have videos that are, saying, "Hey, we should take a more whole person approach. Let's, yeah, definitely exercise, but we don't need to hyper fixate on core stability. But then we also want to address stress, nutrition, and sleep." And then we get a lot of, people who are just like, "No, like none of that works. Nothing works. I'm going to have pain forever." And I'm like, frankly, my heart goes out to those people because the only way you would get that bitter is if you've been in really, really severe pain for such a long time and been absolutely through the ringer with the medical system to the point where you're just at your wit's end. So I get that. But one of the other things that we get is a lot of comments on those types of videos like, no, all you have to do, like all I had to do was back extensions, and that's what you need to do. And it's just blanket advice. So like we get actual people, not even influencers, who also fall into the same trap of saying like, well, for me, all I did was pull-ups and whatever, squats. I did pull-ups and spinal mobility, or all I did was McKenzie exercises and I got better. And it's like, well, okay, but even if, first of all, I guarantee that's not why you got better, right? You
Yeah.
got better because of time and gradually doing more movement, right?
Yeah.
That's
And
mainly.
maybe you have a great job and low stress in your life and you already get good sleep and
Mhm.
like if you're taking all the other boxes, yeah, maybe it is an exercise that might fix it for you. But those aren't the people who are struggling with years of chronic pain.
Mhm. Well, and
Right?
even if they were, because a lot of I've seen people who are like, no, like I had chronic pain forever, and I did all these things, and but then the only thing that actually worked for me was whatever McKenzie exercises, or back extensions, or a Roman chair, or psoas release, or what. Pick your flavor of the month thing, and let's just assume that they're right. Let's just assume, for the sake of argument, that they're like, yeah, no, that 100% was the thing that you needed to do, and it fixed your issue.
Sure.
Awesome. Can you then say that one little tiny thing is going to fix everybody's pain? You
Yeah.
know what I mean?
Yeah. No.
And can you then even generalize that there is one thing for, like, okay, so maybe this person's thing was the psoas release. Well, then the next person is saying, okay, well maybe for me it's my quadratus lumborum muscle, but for the third person, no, it's all about my piriformis. So people still miss the point entirely. Like they'll get like, oh yeah, I get it, I'm unique. So the generalized information that people are saying like, oh, you got to fix this muscle, like I get that for me it might not be that muscle, but then
Yeah.
they totally miss the point by then still falling into the trap of thinking, yeah, I'm unique, but I just need to find my magic muscle.
Right. Yeah. I, it's like you're throwing the simple solution at a really complicated problem. Or you're casting your net too narrowly. Right? Because back pain has so many factors that can cause it. So if you, I don't know, an analogy, I just got back from fishing. So fishing analogy, if you're trying to catch enough fish to like feed your entire village, you're not going to just send out one person with a single fishing rod to like fish in these single locations, right? You're not going to just do, oh, I'll try this one exercise. Oh, that didn't work. I'll try this one exercise. That didn't work. You're going to get a giant net and like troll the bottom of the lake to catch as many fish as you can. Right. So with back pain, you want to hit all your bases because you want to make sure that you're not missing anything. And
Well,
these are
I want to expand on that actually, because I like the analogy, but we could make that way bigger. Because if you had
yeah,
like a civilization, like if you had a city that needed to be self-sustaining, you wouldn't even just fish.
right.
You know what I mean? Because what if the fish dry up, or it's the wrong season for fishing, or whatever, right? You would want to not only fish in mass, but you'd also need to do agriculture and farming and like all learn how to harvest and things like that. Maybe there would be an orchard as well.
Yeah.
So there would be a sustainable system where if one point isn't perfect, there's backups, right? And that's what we're looking at when we're taking a biopsychosocial approach, and or what we call a four pillars approach, which is exercise, nutrition, mental health, and sleep in no particular order. Although exercise is I would say, always necessary, and stress reduction, I would say, is probably always second. For not always, mostly second for many people.
Mhm.
Yeah, if we do that, then if one area is not perfect, we're sort of giving ourselves a safety net by addressing our lifestyle and making ourselves as healthy as possible. And I think when we look at research on chronic back pain and sciatica, and by the way, for anybody watching or watching on YouTube or listening through the podcast, Anything that we're talking about, we can and will gladly send you peer-reviewed scientific studies and references. We have them in like so many other videos. So if you want peer-reviewed citations, we have them and we will give them to you. But when we look at the research on chronic back pain, it really just looks less and less like we could ever pinpoint a single cause for anybody's pain,
Yeah.
and more like the reason why a person has pain is more a reflection of a well balanced physical fitness and overall health.
Yep.
Overall physical fitness and overall health and
Yeah.
lifestyle,
Yeah. Including mental health.
especially mental health.
Yeah. A lot of people, I don't know, if you say health, they won't
Yeah, they're
include
thinking sleep and nutrition, and they're not
that.
thinking. They're thinking supplements.
Yeah. Yeah.
Not yeah
Yeah, I
yeah yeah.
promise you, there's no supplement that's going to be as beneficial to you as having a healthy relationship with stress and just being okay living inside of your own head.
Yep.
Right?
I say this all the time, and it's worth repeating a million times because this is really important and people need to hear it. Is so when we have studies that look at the prevalence of disc herniations and whether or not disc herniations can explain why a person has pain, we see that the risk. So when we look, if we take an MRI of a bunch of people who have zero pain, you would expect them to have good looking MRIs. But what we find is that most of them, depending on the age range, of course, most of them have disc bulges and degeneration and all kinds of other things, annular fissures, etc. So, to take a disc herniation, for example, a disc herniation only increases your risk. So then we look at a group of people who does have pain, and we would say, oh, okay, if 60% of 50-year-old people have disc bulges without pain, then we would say, well, maybe if we look at people who do have pain, we would expect maybe 90% of 50-year-olds to have disc bulges. But what we actually see is that it only increases the chance by like 5-ish%. This is off the top of my head, but it's only a few percent. It's not much. So it does, like having those things on your MRI does impact your risk of having pain a little bit, but not very much, only a few percentage points. But then, and I'm happy to send these studies to anybody who wants them, but we look at depression and stress, and depression increases your risk of developing chronic pain by 2.5 times. So hundreds of percentage points higher, hundreds of percentage points higher, and stress increases it by 2.8 times. So again, hundreds of percentage points versus like 3 to 5% increase.
But if you type in, and I did this yesterday, so if you type in low back pain into Instagram, almost every single video is like magic exercise, fix your disc herniation, fix this. Your discs are being like I literally saw one yesterday where they had a jelly donut.
Oh God, I think I saw the same
like,
one. I think
or
I
they'll
saved it so I could react to it because it pissed
yeah,
me off so much.
yeah.
And for the record, people, your discs are not jelly donuts. Your discs are more like a car tire filled with chewing gum. They're tough, rubbery cartilage.
Yeah. But you don't see like I don't think I've ever seen I don't want to say ever, but almost never do you see a video on social media that talks about depression for back pain or anxiety or
Yeah.
and I mean anecdotally like the hardest people that I've worked with to overcome chronic pain are people who have like really bad anxiety spirals or like those are the people that get trapped in chronic pain.
Yeah, that was me when I was dealing with my shit. I absolutely it was a stress induced, and I was a hypochondriac, 100%. Anytime I had any symptom, I thought it was the end of the world.
Yeah.
Like to the point where some of my symptoms, yeah, I had back pain and some radiating pain down my leg, but I also had the same kind of thing in my neck and arm. And because of that, I was like, oh my God, it's my left arm. So it's a heart attack, or a stroke or a seizure. And I had weird vestibular symptoms and neurological symptoms. So everything was the end of the world. Even when I had a brain MRI and they were like, dude, your brain's fine. I was like, yeah, but I don't I don't buy it. My brain
Yeah.
is screwed, you know? So I thought I was literally going to end up in the hospital or die from these symptoms. So stress just absolutely amps it up. And it's not in your head. It's not just your thoughts. This is the problem. So you say, all right, yeah, when you type in low back pain to Instagram or YouTube, it's all just here's one magic exercise that's going to fix everything. But even if it was all the psychosocial people, like people are really into Alan Gordon and John Sarno and stuff like that. Even if it was that type of content, which I love Alan Gordon, not a
Yep.
fan of Sarno because he makes you feel like it's 100% like emotional,
Yep.
like it doesn't exist basically. And he I think he, if I'm not mistaken, I haven't read his book for a little while, but if I'm not mistaken, in his book he actively discourages using an exercise based approach for rehab, and instead he just basically says to get over your emotions and just go and do whatever you want whenever you want to prove to yourself that you're already healed, which
Yeah.
is really stupid because it ignores the fact that if you've been deconditioned for years, you still, your body, even if you're healed and you don't need to worry about tissue damage, you still need time for your body to regain strength, mobility, and capacity for exercise. Because you could newly injure yourself by skipping steps and doing exercise you're not prepared for.
Yeah, for sure. Yeah, I mean that's why exercise is one of the four pillars. Yeah.
Yeah. Yeah,
Yeah.
I guess what I'm saying is whether you're on the exercise side of things or you're on the mental and emotional side of things, everybody just wants to give you one magic thing that's going to fix everything. Oh,
Yep.
all you have to do is a bird dog. All you have to do is core stability.
Yeah.
Or it's, oh, all you have to do is these nervous system regulation techniques.
Yep.
That's it.
Or
Just do a breathing technique.
you just need to buy this essential oil or let go of the trauma that's being stored in this one specific muscle.
Sure.
Like we like, for whatever reason,
Oh my.
humans love these like quick, like we want quick fixes. Like we want things to be easy, which is fair.
Uh-huh.
But think about like anything meaningful or like that's ever really happened in your life, anything like whatever that is, whether it's a relationship that you really value or a college degree that you're proud of, whatever. It wasn't easy. Like it took consistent time and effort and investment to make a change that was meaningful and lasted. And when we see people get like the best quick fix for what most people would probably ask for would be like winning the lottery, right?
Sure.
And most people who win the lottery, it does not improve their life.
Yeah, that's
Those
crazy.
like quick fix changes.
That's a really good example
Yeah.
with pain is if you don't understand how you got there in the first place and you don't change your lifestyle and it doesn't become a part of who you are, then even if we could fix your, which we can't, but even if we could fix somebody's pain with one magic exercise or a perfect chiropractic adjustment or releasing the psoas or something like that, even if you could, you'd just end up back in the same place you are because nothing changed about your lifestyle that got you there in the first place. Which
Yep.
is funny because I've been doing a lot of like networking and stuff like that, and oh, I'm a chiropractor, and they're like, oh, cool, like you have a clinic. I'm like, yeah, we work online, and they're like, how do you
Yeah.
even do that? I'm like, look, I'm a research junkie. At the end of the day, the things that actually improve people's lives, it's lifestyle change.
Yep.
It's actually changing your lifestyle. If you want to change, you have to change.
Yep. So like with the lottery example, if somebody has really good financial habits and maybe just on a whim one day they buy a lottery ticket, that's probably going to go really well for them if they win because like
Right,
they're a financially responsible human. Usually those people don't buy lottery tickets.
right.
Um, but
But if they
so
happen to come into it,
yeah,
somebody who
just
had
if they happen to.
already, yeah, built financial security and good investing habits and savings and things like that, and they're, pay off their credit cards and, like
Yeah.
that kind of stuff.
But but most people who buy lottery tickets, and no shame if you buy lottery tickets, but most people are not super responsible with their money, and that doesn't change when you have a ton of money
Yep.
and then they blow through it. So for the back pain example, you got to know why you got there and how to fix it. You don't want a magic solution. You don't want, and we kind of have those. Those are like opioids and like nerve burns, and
That's crazy
they
to
don't
me.
really work.
The idea of just having somebody burn off your nerves,
Yeah,
that's crazy.
I
And,
agree.
and again, the research on this too, we quoted this research in several other videos, but it's not even effective.
Yeah.
That sucks.
Yep.
But again, you get desperate, and you desperate to have pain relief now. And then again, it's just a sea of crappy information. So, well, let's try to tie this back to the main question of the episode, because
Yep.
I know people want to make sure that we give them. I want to make sure that we give you guys practical advice. So, what is the best exercise for back pain and sciatica? How would you, in a practical way, like if somebody in our program right now asked you, "Hey, Dr. Blake, what is the best exercise for back pain and sciatica?" What would you
Yeah.
tell them?
It would have to have a couple of characteristics. So one, it's something that you will do consistently. Right? If I tell you to do, that the best exercise is to run for 5 hours a day, well, that's not a very good recommendation because most
Sure.
people don't have time to do
Or let's
that.
just use walking, because I am a
Walking.
big a fan of
Yep.
walking for back pain.
Yep. So first, it has to be realistic. You have to be able to do it, and you have to be able to do it with safe pain or no pain. So like maybe a 3 out of 10 or less pain, what we would call green light. And it has to be sufficiently challenging. So you got to kind of strike this balance between hard enough to make a change to your body, because your body will only adapt if you give it something that's kind of challenging, but it can't be so hard that it's going to flare up your symptoms. So like, for example, one person, let's say we take like two opposite ends of the spectrum. Let's take like world champion strongman. Well, let's say they have back pain when they deadlift. They come in, they're like, when I deadlift over 600 pounds, I start to get some back pain. It's like, okay, well, for you, the right exercise that might be hard enough still, but doesn't cause you symptoms, might be doing higher repetitions with 500 pounds. But for somebody who is really sedentary and hasn't exercised in 5 years,
And frankly, for somebody who most people that we work with
yes,
are on
yep,
this what Dr. Blake is about to give an example of is probably most of you.
yeah, for sure. Or even if you just have a lot of pain and you are physically active, the best exercise might be a 5 minute walk, or some belly breathing, or a bird dog, right? Like easy, simple stuff that you
Whoa,
can do.
bird dogs. I thought we hated bird dogs and core
Yeah,
stability.
I don't hate any exercises. All exercises are just tools. They're just tools to fix a solution, or tools to throw out a problem in creative ways, right? Like if you asked a carpenter what's the best tool, it's like that's a stupid question. It
Yep.
depends upon what I'm
Yeah, or a
trying.
chef, what's the best ingredient?
Yeah, it's like it depends what I'm trying to do.
Yeah, what are we trying
So
to make? What are we cooking?
yeah, so for most people, the best exercise is going to fall in this category of, this is challenging enough to like actually do something, right? If we gave a bird dog to somebody who only has pain when they deadlift 600 pounds, that's dumb, right?
Yeah, it's stupid.
It's not challenging enough. So it has to be sufficiently challenging. And for most people, that's going to be like somewhere in the range of like some simple spinal mobility, maybe some simple core work, because those will be challenging enough, but not so challenging that they're going to flare up their symptoms. So you have to strike this balance. And that's where most people fail. They usually recommend like a Jefferson curl. That's way too hard for most people.
Yep.
But like belly breathing, or like a bird dog, that's going to be quickly too easy. That might be good for like a few days, maybe a week, but
Yep.
we got to progress past that.
That point that you just made is probably the most important point. If you guys take one thing away from this episode, it should be that the exercise. Let me try to summarize that.
Yep.
Your exercise selection should be choosing something that is achievable with safe pain levels, right? Meaning it's not too intense, but still challenging enough that it pushes you a little outside your comfort zone without flaring you up.
Yep.
That's it. As you do that, your body will adapt, meaning you have to progress your exercises. You
Yep.
have to make your you have to choose new exercises. So even if I could give you the perfect exercises for you and your condition and your abilities right now, it wouldn't be helpful long term because you would still have to understand concepts to be able to progress to more difficult things over time.
Yep.
You have to progress, and that's the problem with PT. We just got a new client in our back pain program that is a well, I won't get into details, but one of the things that we were talking about was like, okay, you've done PT, right? Yep. Okay, how long? Like a year. And I'm like, okay, cool. What are you doing? Let me guess. It's core stability. And she's like, yep. And I'm like, okay. And have you ever progressed your exercise? She's like, no, like I went to PT and then, I basically just kept doing those exercises for the last year. I'm like, oh, okay. And this is a person. If you're listening, I hope you don't mind me sharing a little bit about your story. But who knows who she really is. Anyway, but she was like, she wants to get into triathlons, right? I'm like, how? And she's like, oh, I was like, what causes pain? She's like, oh, twisting causes pain. Bending over, picking things up causes pain. Transitional movements cause pain. Running, can't run. Running causes pain. Swimming, biking, right? So all these activities cause pain and she can't do them. And I was like, okay, so for a year of physical therapy, you've been given and just basically doing core stability exercises. How like if you want to train for a triathlon, what do you have to do to train for a triathlon? And she's like, well, you have to run and bike and swim,
Yeah.
right? And then you have to run and bike and swim more,
Yeah.
right?
A lot
Okay,
of
cool.
running, biking, and swimming.
Yeah, there's a lot of running, biking, and swimming, and you start off by running a little bit and biking a little. Okay, but I was like, okay, so if you want to be able to run, bike, and swim, you have to do more and more of that over time. And no amount of core stability training on the planet is going to prepare you for swimming, right?
Yep.
It just it's not similar enough to the activity you want to do. Same thing with twisting. Oh, she's like, oh, I have pain when I twist.
Yep.
If your entire rehab strategy is core stability bracing, which is deliberately trying to minimize movement of the spine, how, when you twist, which rotation is a necessity to twisting, you literally cannot twist without rotating your spine. If you never train little amounts of twisting,
Yep.
how do you expect ever to be able to twist safely without pain? Oh, bending over hurts. Okay, do we want to solve that issue or make it worse? Because if we want to make it worse, let's avoid bending forever because now you're deconditioned and you never practice it. So now when you do eventually have to bend in real life, of course you're going to flare things up and be on the floor and have to go to the fucking ER because you flared things up because you never practice it and it's a self-fulfilling prophecy. But if you want to solve the problem of not being able to bend, then we need to gradually reintroduce bending, right?
Yep.
So the core stability was a good strategy for one of the things she had an issue with, which was transitional movements.
Yep.
In which case, absolutely. And we teach a belly breathing brace for transitional movements in acute pain, but it doesn't address any of the other things that you're doing in real life.
Yep. Yeah, and for a week or two, maybe those core stability exercises were perfect, but they probably quickly became too easy, and then you just get stuck there. It's like if we go to like an exercise example, you're like, I want huge arms. Why are my arms bigger? And it's like, well, what have you been doing? It's like, well, I've been curling. I've been doing 3 sets of 10 with 15 pounds for the last year.
Mm-hmm.
It's like, well, is that hard? It's like, well, it was hard for the first 2 weeks, but now it's really easy, which is nice because then I don't I don't have to work as hard. It's like, well, that's why your arms aren't getting bigger because you have not increased the weight.
Well, and to expand on the analogy too, it's like, okay, let's say I specifically want, bigger biceps,
Yeah.
right? And you're like, okay, not only are you underloading, meaning you're not challenging yourself enough when you do weightlifting, but what exercises are you doing? Oh, well, a while ago I hurt my biceps doing bicep curls, so I never do bicep curls ever.
Yeah.
I only do rows and shoulders and
Yeah.
lateral raises and back flies
You're like,
and dips. I'm like, wait. You didn't name a single bicep exercise.
yeah. Well,
Well, yeah,
rows
because the
like
last
it.
time I did bicep exercises, I hurt myself.
Yeah.
But you want big biceps?
Yeah.
Fucking
Yeah.
do bicep curls. It's the same thing with back pain. Oh, you want a strong back and you want a mobile back? Then move it and strengthen it.
Yeah. Yeah. You just need to start with small steps.
Yep. Yeah. So let's just kind of summarize here. The most important thing is on social media, just realize. Oh, and I wanted to point out one thing you said before we actually started the podcast officially that I
Yeah.
thought was funny because you were like, yeah, on social media, the influencers will say like, they'll come on. Do this one exercise, it's going to instantly fix your back pain. This is the best exercise for back pain. And then they show you whatever, let's say it's a bird dog or something.
Yeah.
And then you scroll to the next video on their actual page. And
Yeah.
what is it? And then the next video says, hey, here are the 3 best exercises for back pain and sciatica. And that other video or that other exercise that they said was the best isn't even on their top 3
Yeah.
list on this video. But
Yep.
they're both the best exercise, and they're both the one that's going to instantly fix your pain. So what
Yep.
Blake was saying before we started was like, even if you actually tried to do exactly what those people are telling you to do by the book, you'd be lost.
Yeah. You'd have like 100 best exercises, and you're like, I'm supposed to do all of these like if you literally tried to follow their advice, I think you'd just be doing 100 different exercises
Yeah.
every single day.
You know what it's like? I saw a compilation. Somebody really kicked ass with this. It was Bobby something rather. It was making fun of the nutrition guy, Bobby. Like Bobby, it's Bobby approved. This
Oh,
salmon is Bobby approved because it
I know
doesn't
what you're
have
talking. I know.
whatever.
Yeah, I know what you're talking about.
And like I'm making fun of him because this compilation, it was like he goes, well, you should never eat salmon because Atlantic farm raised salmon, they add carotene in the pellets to, make it a red color. So it's artificial, blah, blah, blah. And then, so the guy is taking notes and he's like, okay, so don't eat farm raised salmon. Got it. And then
Yeah.
and then it goes to another clip of Bobby and he's like, well, so let's make some salmon and we're going to cook it here. And farm raised salmon actually is really good for you because it's got great omegas and blah, blah, blah. And you're like, wait,
Eat.
unless it's teriyaki salmon.
Yeah.
It's like whatever.
Unless it's from a company that Bobby has partial ownership in.
Yeah, exactly. I think that's really what it is.
Yeah.
So it's just like him constantly contradicting himself for like 2 minutes straight, and you're like,
Yeah.
okay. So, and this is part of the reason, like I know on our channel, sometimes people, I get that it's frustrating because we want to give you solutions. We want to tell you what to do, but it's not that we're trying to hide some secret sauce. Like we want you to know what to do. But if we tried to tell you, just do these exercises, if we did get it right, it would only be the right exercise for like a week or two before you got stronger and you need new exercises.
Yeah.
And if we get it wrong, then you're either going to flare things up because you tried something that you weren't prepared for, or you're just going to be in rehab purgatory, babying yourself forever. So we want to teach you concepts. We want to teach you how to understand what is too hard, what is too easy, when do I progress, what is safe pain versus unsafe pain, and how do we address lifestyle factors that also impact pain. So the perfect exercise, the best exercise for back pain is something that is challenging but does not flare you up, something that you will actually do. Hopefully, if possible, something that you might even enjoy doing would be really nice. And then make sure that you're not obsessing about just the exercise without also accounting for lifestyle stress, anxiety, depression, fear, as well as sleep and nutrition. That's what we really need to do. Because even if we're just talking about the physicality of building resilience, nutrition, sleep, and stress are going to impact your recovery. Like if we had a bodybuilder who was trying to train for a bodybuilding competition, like the most physical thing on the planet, their performance is going to suffer. Or an athlete, like a football player, NFL or something like that, they're
Yeah.
training for a big game. If their nutrition, sleep, and stress are, if their head's not in the game because they got in a fight with their partner the night before, or they ate, too much spicy Thai food, which wrecks me for a day.
Love spicy Thai food.
I love it. It doesn't love me, but
Yeah.
or whatever your nutrition or your sleep is off, they're gonna play like crap. They're gonna have a terrible game, right? And your recovery is the same way. So that's it for today's episode. If you want to learn more about working with us one-on-one and getting a personalized plan, then watch our masterclass. The link is always in the description, where we do a deep dive on exactly like case studies and how we would actually work through back pain with specific examples. All the research on the planet telling you exactly what to do and why to do it. And then we give you an opportunity. If you want to work with us, you can apply for our program, and you can even talk to me. You can hit me up on Instagram. So watch the masterclass, and we will see you in another episode.